Okay, everybody, welcome. Thank you very much for joining us for our DOPPS Practice Monitor update, based on our update at the end of September, at the end of August, just a couple weeks ago. Thank you so much for joining us. So we have trends through at least April of 2016, May of 2016. So thank you so much for joining us. We have sort of a packed agenda today, so we'll get things rolling. The first slide is, as always, we would like to give a warm thanks to our study funders, including the principal study funders, Amgen, Baxter Healthcare, Kiwahaku Kirin, and additionally with additional support from other organizations as listed. And we thank them very, very much for their support of our independent scientific research. Okay, so the WebEx that we have today is based, again, on data from our DOPPS Practice Monitor, which is our publicly available reporting of very up-to-date trends in U.S. dialysis care. This is here's just a screenshot of our web page, and of course we encourage folks to browse this web page. We have indeed over 1,500 tables and figures. So figures along with underlying data tables for all of our figures. We actually have data since the middle of 2010, so actually 6 years of data now. We launched the DOPPS Practice Monitor in particular when the ESRD bundled payment system was updated in January of 2011. It feels like a long time ago now, but we still had quite substantial trends in dialysis practice that I think are very interesting and important to keep the community updated on. Currently, so the DOPPS sample of dialysis units is based on a stratified random sample across the U.S. Now we have approximately 200 facilities in the U.S., including contributions from the two largest dialysis organizations, DaVita, Fresenius, as well as electronic health record data from VisionX, an important EHR provider for the dialysis community. And through those data, we have detailed information from the centers other than other than the LDOs. Okay, as always, we welcome your feedback and also input, and in particular, just putting a plug in, asking you to join our conversation on Twitter. We have information up on this slide with respect to joining the Twitter feeds related to DOPPS and the DOPPS Practice Monitor. And just to note as well, slides that we are presenting now will be posted on our website, DOPPS Practice Monitor website, shortly after the presentation. Okay, well, today's topics and speakers, Michelle Wong will give an update on trends in interdialytic weight gain, which I think are very, very interesting and important. So it should be really important segment of the hour today. Doug Fuller will provide an update on trends in anemia. Brian Beaver will provide an update on mineral bone disorder trends. And Mark Newman will provide us an update on important policy changes and anticipated changes relevant to the ESRD community. Mark Newman, of course, leads nephrology news and issues and co-hosts this WebEx along with us. And Mark, as always, we thank you and NNI for your support of DOPPS and the DOPPS Practice Monitor and for that collaboration. Thank you. CNE credits are available, as noted here. Again, slides will be posted just after the session with this information as needed. The learning objectives really relate to the outline of the agenda today, so I won't spend additional time on that just now. We are interested as well in, for those of you who've called in before to the WebEx, we're very interested in making this as interactive as possible, so very happy to hear from you electronically and therefore welcome your questions throughout the session. You can actually submit questions using the Q&A feature to all panelists, which is accessed from the main menu. located at the top of the presentation screen. So again, if you are able to post questions, we will do everything possible to find time to answer them, either within the context of the WebEx or electronically afterwards. All right. Additionally, for the last several WebEx sessions, we've been using interactive polling, where we're really just interested in your opinion on key dialysis practices that you're most familiar with. To note as well that your individual responses to these polls will remain confidential. When the poll is opened and pops up on your screen, please answer the question and don't forget to hit the submit button. And if you don't see the poll question, click on the polling button with the icon shown here. And with poll questions in mind, actually under our first screen of poll questions just before launching into the first topic today. So IDWG refers to interdialytic weight gain, so the amount of weight gained by patients between dialysis sessions. So the average IDWG of patients in my dialysis unit now compared to 5 years ago, if you could answer as to whether that is unchanged, higher or lower. And again, we're really interested in just your gestalt or general opinion. You don't even need hard data to back this up, just your feeling about how things have changed over time. Number two, the emphasis provided to patients in my unit to limit salt and fluid intake is unchanged, greater emphasis or less emphasis. Number three, the frequency of assessing target weight in my unit compared to 5 years ago, has that been unchanged, less frequent assessment, more frequent assessment, but based on essentially old-fashioned clinical approaches that we've used, or more frequent assessment, but by use of newer technologies such as bioimpedance, critline, et cetera. And then lastly, the last question we wrote, essentially with the patient, thinking about a patient-centered focus, as the community becomes more and more focused about what really is important to the patients and how patients are feeling. If average weight gain is lower in your unit now compared to 5 years ago, how does that in general affect your patients? They feel better, they feel worse, or no difference? Okay, so if you could, those polling questions will be available, Brian, through the end of the next session?
Yes.
Yeah, so for approximately the next 5 to 10 minutes as Michelle Wong presents, and then we'll go over the results that we've gotten on them.